As we age, our bodies begin to send signals that are often ignored due to fear, shame, or simply a lack of awareness. It is quite common to hear men over the age of 55 commenting on noticing a certain swelling in the groin area, a feeling of heaviness in the testicles, or even pain that appears suddenly and then vanishes. But is this normal? What is really going on down there? The answer may involve three distinct conditions that affect millions of men in Brazil: hydrocele, varicocele, and inguinal hernia. While they may appear similar at first glance, they are completely different in detail. And understanding this can prevent misdiagnoses, prolonged discomfort, and even serious situations requiring emergency surgery. The first thing you need to understand is that the scrotum, the pouch that houses the testicles, is a highly sensitive and complex region. It contains blood vessels, ducts, tissues, and nerves. Any alteration in this area can trigger a visible change, such as a volume increase, a different sensation of heaviness, or mild to moderate pain. These changes are often frightening, primarily because they directly impact a man's virility, but most cases are treatable, and if diagnosed early, the path to recovery is significantly smoother. The major issue is the delay in seeking help. Many men wait months or even years to consult a professional, and during that time, the condition can progress, potentially jeopardizing fertility, causing physical limitations, and, in some instances, leading to serious complications. Let's begin by discussing hydrocele. It often causes alarm because it results in a sudden enlargement of one side of the scrotum, generally without pain. This occurs due to an accumulation of fluid around the testicle. This fluid is clear, like water, and builds up between two layers that normally only contain a small amount of natural moisture for protection. The man notices that one testicle feels full, as if there were a water balloon inside. It doesn't hurt, but it's uncomfortable, heavy, and can be embarrassing. In many cases, this fluid appears without a clear reason, but it can also arise after an impact, inflammation, or even as a residual effect of an infectious episode. The good news is that, in most cases, hydrocele does not cause infertility or directly affect erection. The bad news is that, if left untreated, it can grow, causing discomfort when walking, sitting, and even during intimate relations. Treatment depends on the size and cause. Small hydroceles can be monitored. Large ones are usually corrected with a simple surgical procedure that removes the excess fluid and prevents further buildup. Now that you understand what a hydrocele is, it's important to know about varicocele, a distinct condition that also causes visible changes in the scrotal sac. Essentially, it is a dilation of the veins that drain blood from the testicles. These veins, which should function like perfect valves, begin to malfunction, allowing blood to flow backward and pool. The result is a tangled mass of dilated, tortuous veins that often resemble a worm sac to the touch. Varicocele may or may not cause pain, but it is frequently associated with male infertility. Many men discover they have varicocele only after experiencing frustrating attempts to conceive with their partner. It can also cause discomfort when standing for prolonged periods, during physical activity, or on warmer days. Generally, it appears on the left side of the scrotum, but it can also be bilateral. Varicocele treatment is necessary when it causes pain or affects sperm quality. It can be performed through conventional surgery or embolization, a modern and minimally invasive technique. We now turn to inguinal hernia, perhaps the most dangerous of these three conditions, precisely because it is often neglected. A hernia occurs when a part of the intestine, or another abdominal tissue, manages to protrude through a weakness in the muscle wall of the groin area. This piece forms a bulge that can end up in the scrotum, giving the appearance of enlarged testicles. Unlike hydrocele and varicocele, a hernia can be pushed back in during initial stages. Many men report feeling a lump that appears when lifting weight, coughing, or standing for too long, but which disappears when lying down. This mobility is one of the main clues for diagnosis. However, if the hernia becomes incarcerated, what we call strangulation, it can cause intense pain, nausea, vomiting, and a risk of intestinal necrosis. In these cases, surgery must be performed urgently. Therefore, if you notice any mobile protrusion in the groin or scrotum area, seek medical attention before the condition worsens. Inguinal hernias are most prevalent in men over 60, but they can develop earlier, particularly in those with a history of heavy lifting, chronic coughing, or frequent constipation. Treatment invariably involves surgery. Fortunately, contemporary techniques are significantly less invasive than past methods, featuring smaller incisions, expedited recovery, and reduced pain. Many patients can resume light activities within days, and within weeks, they are fully recovered. Contrary to popular belief, A well-executed hernia repair does not impact a man's sexual life. In fact, it enhances well-being and alleviates the constant fear of pain recurring during intimacy or physical activity. Now that we've covered the 3 conditions, it's time for you to actively engage with our content. If this video or text has already helped you clarify doubts or alerted you to a symptom you've been ignoring, subscribe to the channel right now. But there's more. I want to propose something different. Write in the comments if you've ever noticed any unusual discomfort in your intimate region and haven't sought help. It could be a recurring swelling, a feeling of heaviness, something that only appears when you strain your abdomen. Share with us, without shame. You're not alone, and your comment could empower other men to speak up too. We need to break this silence that only delays diagnoses and harms lives. When a man notices something unusual in his genital area, whether it's a swelling, mild pain, a change in shape, or a new protrusion, the first step is not to panic, but also not to delay investigation. Understanding the signs is crucial for differentiating these 3 conditions. For instance, a hydrocele is typically asymptomatic. The testicle swells continuously, the volume increases noticeably, but there's usually no pain. A simple home test can be performed with a flashlight. By shining the light behind the scrotum, if it shines through or lights up with a reddish hue, it may indicate fluid accumulation. This should never replace a medical examination, of course, but serves as a warning sign. Varicocele, on the other hand, tends to be more subtle. It presents as a sensation of heaviness at the end of the day, particularly after prolonged standing. In certain instances, men describe feeling like they have a network of wires or a lump of veins on the left side of their scrotum. A temperature difference can also serve as a clue. The affected testicle may feel warmer due to blood reflux. Many men are asymptomatic until undergoing fertility examinations. Consequently, couples struggling to conceive should always consider this possibility. A hernia is now more insidious. It manifests as a lump that comes and goes. It can be small or large, but it usually appears with physical exertion or when coughing. It is often more noticeable when taking a bath, putting on underwear, or lifting weights. When lying down, it often disappears, giving the false impression that it improved on its own. But this is not true. A hernia never resolves on its own. Once formed, it only increases in size, and if left untreated, it can lead to complications. Therefore, upon noticing any changes in the groin or testicular area, a man should seek medical evaluation. Relying on Dr. Google or asking friends at the bar is not advisable. Every body is unique, and diagnosis requires a physical examination and at times imaging tests. The good news is that modern and safe tools such as Doppler ultrasound are now available. This technology allows visualization of veins, accumulated fluid, and even parts of the intestine that may be displaced. This non-invasive, quick examination provides invaluable clarity in differentiating conditions. Moreover, we must not overlook the significance of medical listening. A qualified professional will know how to ask the right questions, identify patterns, and provide empathetic guidance. If you encounter a practitioner who downplays your concerns or makes light of your inquiries, seek a new physician. Male intimate health deserves to be treated with respect, seriousness, and compassion. Receiving a diagnosis such as hydrocele, varicocele, or hernia can initially be quite jarring. Many men worry about their virility, the impact on their sex life, and even the possibility of surgery. However, medicine has advanced significantly in recent decades, and today the treatment of these conditions is, in general, straightforward, safe, and boasts a high success rate. Let's delve into a better understanding. A hydrocele, when small, may require only observation. However, if it grows and causes discomfort, surgery is the most advisable course of action. This procedure, known as hydrocelectomy, involves the surgeon making a small incision to drain the fluid and repair the affected area, preventing further accumulation. Within 2 weeks, the man can typically resume his normal activities with basic care and restrictions on strenuous physical exertion. Varicocele treatment is generally recommended when chronic pain or infertility is present. The most common surgical technique involves the ligation of dilated veins. Embolization, performed via catheterization, is another option, offering a less invasive approach. This procedure involves blocking defective veins, leading to improved blood flow. The outcome is a more balanced testicular environment, potentially resulting in a significant enhancement of sperm quality and a reduction in discomfort. A hernia, in turn, requires special attention. There is no clinical treatment for it. The only effective treatment is surgical. The good news is that current techniques, such as laparoscopy or video-assisted surgery, allow for smaller incisions, less post-operative pain, and faster recovery. In many cases, patients are discharged on the same day. With the use of modern surgical screens, the risk of recurrence, that is, the hernia returning, is significantly reduced. Regardless of the type of treatment, the key is not to delay. The earlier a diagnosis and treatment are made, the better the quality of life and the lower the risk of complications. And here lies a crucial point. Sexual life often improves after treatment. Many men report that pain during sex disappears, they feel more confident and even more emotionally liberated. After all, living with a silent, intimate problem generates anxiety, shame, and limitations that go beyond the physical. That is why this content is so crucial. Informing saves lives, empowers informed decisions, and restores agency, allowing individuals to care for their own bodies without fear. Reaching the end of this content, you might be wondering, why is this topic still so rarely discussed? The answer lies in the culture that has been built over generations. Many men still see intimate health as taboo, something to be hidden, ignored, or addressed only when it's already too late. This needs to change. There's nothing shameful about experiencing groin pain, noticing an unusual swelling, or wanting to understand what's happening with your body. Shame is suffering in silence, is delaying care that can transform your life. Hydrocele, varicocele, and hernia are common conditions. Treatable and, when properly managed, allow for a long, active, and unrestricted life. Understanding the differences between them equips you with the tools to take action, communicate with the right healthcare professional, and seek the best possible care for yourself. And now, I want to speak directly to you, who made it this far. If this content has helped you in any way, whether by clarifying doubts or giving you the courage to seek help, I extend a special invitation. Subscribe to the channel now, and continue this journey of self-discovery and men's health with us. Here, we treat the male body with the respect and clarity it deserves. Moreover, share your thoughts in the comments. Have you personally encountered any of these issues? Do you know someone who has? How was their diagnosis, treatment, and recovery? Tell us in the comments what you learned from this video, what particularly caught your attention, and if you'd like, we can continue this conversation.